Popular trends like hair loss medication and using diabetes drugs for weight loss are on the rise. But at what cost? Court is talking with dermatologist Dr. Oma Agbai to learn more about the potential side effects.
Yeah, so you may have heard something called Ozempic face, right? A lot of people have, you've seen the commercials for Ozempic, but it's now being used, it's a diabetes medication, but it's now being used by some as a weight loss medication that can cause issues with hair, with your skin. We've got Dr. Oma Agbai with the dermatology department at UC Davis. Good morning to you.
Good morning, Courtney. So glad to be back.
Oh, I'm so happy to see you here. So but the first question is, though, what is Ozempic face? Of course, that's in air quotes. What does it look like?
Right, so there are changes of the facial skin that can occur anytime you lose weight rapidly. You lose a lot of weight rapidly. This is not only seen with Ozempic. So what you can see are something you can think of as an analogy would be like a deflated balloon. So let's say you have a balloon that is deflated. You can have facial skin that is sagging, that is loose. Specific findings on the face would be things like sunken skin on the temples.
Okay, and we've got a picture that kind of illustrates what you're talking about, even around the mouth area.
Right. You can have increased folds around the mouth. Something called the nasolabial folds can become more prominent.
Okay.
You can have increased hollows of the cheeks and just a general sunken in and sagging feeling and appearance of the face.
Okay.
The inferior chin and the front of the neck can also become very loose. And so some patients experience this and notice it, and then they are troubled by it because they're saying, oh, people are telling me I look sick, or I don't look normal. So what is this? Or do I have some kind of accelerated aging kind of appearance of my face? So some people are troubled by this, but in and of itself, it is not a medical abnormality.
Okay, that's good to know. And I want to make sure that we get those pictures up, because so what do you tell people when they say that this is the issue? As you mentioned, it's not an abnormality, it's a concern, I guess.
Right, so it depends on how the patient feels. If a patient feels like they don't look like themselves after losing a lot of weight, after starting a medication like Ozempic or similar medications, then there are cosmetic options. You can have injectable hyaluronic acid fillers, you can have autologous fat transfer procedures, or even facelifts. And these are things that can be performed by a board-certified dermatologist or a board-certified plastic surgeon, depending on what you would like to have done.
Okay, now let's talk about the hair loss or hair thinning that some folks have noticed with using minoxidil, which is in lots of like Latisse, Rogaine, things like that.
Right. So minoxidil comes in a topical form as well as an oral form.
Okay.
And the topical form is FDA approved for hair loss. The oral form is not actually FDA approved for hair loss, but it is being used. And there's been a lot of media buzz around that. There's been a lot of public interest on oral minoxidil for hair loss. And so patients have been reaching out to me asking, well, how can I get my hands on this medication? And so it's really important to understand there are some possible adverse effects. It can be used successfully for hair loss. I've used it a lot and patients have been very happy, but there's some possible side effects that are associated with using oral minoxidil. Specifically, you can have unwanted hair growth where you don't want to grow hair. You can grow hair on your face, on your body. Sometimes patients will start the medication and then experience the fine, fuzzy hairs on the face or on the body. You can also experience some more serious side effects like low blood pressure and swelling of the legs, swelling over all over the body actually has been
Let's take a look at Miss 4 and see some of those pictures that we're talking about there. So, so that's the hair loss in some of the hair, like the temple areas and such. And then if you advance to the next picture, this is what she's talking about. Just arrow to, there we go. Hair in unwanted areas.
Correct.
Kind of around the ears and such.
Correct.
And then one more picture, that's the swelling. If you hit the right arrow, there we go. The swelling that you're talking about.
Correct, absolutely. So those are things that have been reported with oral minoxidil. And then back to the question about Ozempic and weight loss medications. Yes, 1 to 5% of patients are experiencing hair loss after losing a significant amount of weight. It's something called telogen effluvium. It can be very scary, hair shedding all over, and I have treated patients for that. And so that is something that can happen, but it is rare. The key is to talk to your doctor about these medications, communicate communicate with them. Make sure you're on the same page about whether or not you really need these medications for medical reasons, and make sure that the benefits outweigh the risks of taking those medications.
Great points. All right, and I know you're probably having questions at home. I want to make sure you know how to contact Dr. Agbai. She's on social media. You do a great job with your social media posts, answering questions and such. And you can also pose your questions to her on her social media pages. We're going to link everything for that, as well as UC Davis Dermatology Department, to our website, gooddaysacramento.com, under show info and today's date. Dr. Agbai, thank you so much.
Thank you so much, Courtney.
Always
So
a
good to
pleasure.
see you.
All right, T, back to you.
All right, good information. Thank you very much. I actually know a couple friends that are doing that.
Having some of the issues,
Not the issues yet.
Okay.
I want to warn
That's good.
them.
Hopefully they won't.
Hello.
Yeah.
Yes. All right, thanks, guys.